This week on Arizona Illustrated, the Golden Rule.
I just love working with nature, working with animals, and working with the soil.
The rise of substance abuse.
We are seeing a lot of returns to chaotic use, which is also leading to a rise in overdose fatalities.
Living tiny provides new horizons.
It was a really freeing feeling to not have so much stuff.
Welcome to Arizona Illustrated. I'm Tom McNamara. Today we're filming at the University of Arizona's Campus Agricultural Center, a 160-acre research, teaching, and extension facility north of the main campus. This center supports the functions of the 11 colleges in the departments of agriculture and life sciences, and is currently home to more than 70 multidisciplinary studies in its fields, greenhouses, and laboratories. As always, the AZPM crew is masked up and we're keeping a safe distance from each other. And here's an update on the coronavirus in Arizona. Arizona's cases, deaths, and testing numbers have remained relatively stable over recent weeks. The state's 7-day case rate recently ranked 42nd in the nation after ranking first and second for much of January, according to the CDC. Meanwhile, state health officials announced that walk-ins are now being accepted at state sites in Metro Phoenix, Tucson, Flagstaff, and Yuma. Nearly 2.9 million people have had at least one vaccine shot. For more coronavirus news, visit azpm.org/coronavirus. Where does our food come from? You know, with the many conveniences of modern-day life, we sometimes forget that real food comes from growers and ranchers and farmers, not from supermarket shelves. Arizona claims a rich agricultural tradition that continues to this day. We went to southeast Arizona to visit a farm with a rich history of its own.
Well, there's no traffic. There's no traffic, and it's peaceful out here. A lot of fresh air. There's times it's hectic because, you know, you have your schedule set up, and first thing you know, something breaks down, and you got to work through that. But that's normal. That's normal human life.
We get to enjoy the smells of nature. We don't have city smog. We don't deal with any of that. So much so that when you're on the farm and then you go to town and you see everyone with the masks and, oh yes, there is something else going on in life.
You forget your mask, you know. You forget about oh yes, I gotta have a mask here, you know.
You just don't think about those kind of things as much.
I just love working with nature, working with animals, and working with the soil. It's quite gratifying because that animal loves you and you love that animal. And in that environment, they can produce their max quantity when they feel that love. It's a very healthy environment. They say the more she chews her cud, and the more she lays down, the more relaxed they are, the more milk they can give.
We actually went to the same school together, so we were acquainted with each other. But it was at a farm sale where he really asked me, and it blossomed from there, and we got married 5 years later.
Come on, let's go.
For the first 8 years, we farmed in Pennsylvania and had 4 children before we moved west.
It's in our blood, and that not just us, but our grandparents, our great-grandparents. It might even been our great-great-grandparents were all dairy farmers. Mm-hmm. So it come from way back. We were raised without TV, raised without radio. Work was our recreation. It was ingrained into us to do a good job of whatever we did, put our whole heart into our work. And my children, that's in them too.
When we moved here, 4 of them were already married. 10 total, there's 6 married and 4 at home. Jessica, Jenny, Jalen, Joylyn, Justin, Joanna. It's Joshua, Jared, Jesse, and Jubilee.
Oh my, it's awesome. Especially among the grandchildren. We have number 14 on the way now. They come in, you know, with their hands up in the air yelling, "Paw Paw," you know. It's just tremendous.
I have a very strong family tie. That's just the most important on this earth to us.
There's 1 girl, Jubilee, and 3 boys, Joshua, Jared, and Jesse, are still here yet. I try to get out there around 3:30, and then I have like 30 minutes to prep everything up, sanitize the pipelines, make sure everything's set up okay. The main thing is to have a setup that is approved by the state. You got to get it certified with the state and to make sure that they approve of it. The state will test like once a month for coliform. That tells them how clean our milk is. We test on the farm also for coliform and E. coli, and we keep it a 0. Every milk tank full, we test it.
Well, we brought in the cows and we're milking them. We'll milk them all, and we just feed them all through. I think we're milking about 43 right now. Every morning and every evening at 4 o'clock. So we get up at about 3:30, get out here and we'll do the feeding. Jesse and Dad usually work at the milking.
We make sure the udders are totally clean. We have a sanitizing soap mix I use, and you wash the udder off completely and then let it dry. And once it dries, there's no bacteria there whatsoever.
Whatever projects we got around the farm for the day, we'll work at that, and then 4 o'clock in the evening, we'll do all the chores again. You get used to it after a while. We still have some times where we get out a little late, but yeah, it's really nice just to be able to work with my family. Fun to be working with my brothers and doing farming and outdoor stuff. That's what I like to do, so everybody can work together and do what needs to be done.
And then once we're all finished, then we wash everything down, wash all the pipelines, sanitize all the pipelines. We do that after each milking.
We have about 425 chicks that we're raising and a flock of about 65 chickens. If I have extra eggs that the customers don't buy here at the farm, I take them to my little Bisbee market and sell them there. And this summer we hope to have eggs for all of our milk customers. We'll take eggs with us on all our deliveries.
We keep coming back because honestly it's the best milk we found for our family ever. It's so creamy, it's full of nutrients. They are such an amazing family. They invited us out to their farm. We brought the whole family and they spent hours like showing us their animals and how they bottle and produce the milk, and the kids got to play with their daughter Jubilee. We had such a blast. It was so fun. Today I got 6 half-gallons of milk and their butter. They just started selling their homemade butter. So it's pretty special.
When we hear others saying how it blesses them, that just makes it entirely worthwhile for what we're doing. We're blessed. Hence the Golden Rule Dairy name. We like to treat others as we are being treated.
Mom's a good cook. I mean, she makes butter, yogurt, ice cream, tons of ice cream. We're eating ice cream all the time. Probably a little spoiled, but yeah, good stuff.
Who's that letter?
J.
And that one?
K.
Since we started, we've always prayed before we bottle the milk. We also pray that it blesses the people who drink it, and it's a good feeling, you know, to be making good food for other people. I think that God's blessing is in the milk for sure.
What thrills my heart is to see my boys learn how to get up 3 o'clock in the morning, every morning, and feel the responsibility to get up and get the chores done and get them done correctly and make sure the cows are all fed right. And sometimes, me as a dad, I get uptight and my boys say, "Hey Dad, it's okay," you know. They help me out too. It doesn't go just one way, it's both ways. I learn a lot from my children. And the main thing is that we have love for each other.
Substance abuse of all kinds has been on the rise during COVID-19. Unemployment, social isolation, and less access to care are just a few of the reasons why. With deaths from overdoses on the rise across the U.S., it's more important than ever to destigmatize substance abuse, learn what harm reduction is, and make critical adaptations to our healthcare system.
It's really hard for everyone. Everyone has had to deal with feeling isolated and having their lifestyle changed in some really important ways. So for folks who are in recovery, especially in new recovery, those things are even harder to tackle, and it puts them at increased risk for overdose.
It's just over 1 year since COVID-19 changed everything about how we operate as a society. The pandemic has led to a surge in substance abuse and forced many changes, leading to an increase in new users, relapses, and overdoses. People on the front lines fighting the opioid epidemic say that death rates are on an alarming rise.
We've seen these deaths of despair. We've seen this increased rate of overdose fatalities. This is the highest number. 2020, we have never, ever seen numbers like this in Arizona.
Prior to the pandemic, we were kind of hopeful that the opiate overdose rate would start to come down. We had some promising data. We're like, okay, we might see like a 1, maybe a 4% decrease. And then the data was just released for 2019 through the June of 2020, and it actually increased another 10,000 deaths.
One of the things that we're seeing an increase in, and an increase in mortalities related to, is the use of methamphetamine. We're seeing it used in combination with opioids, and we're seeing mortalities from the combination, but we're just also seeing mortalities where it's the identified drug from the mortality.
The Pima County Health Department has reported that heroin and fentanyl seizures are up more than 20 and 40% from last year. Since July of 2020, more than 95,000 fentanyl pills have been seized, which is more than double of what was confiscated for all of 2019.
One of the rising concerns about the drug population in Tucson is a lot of things are cross-contaminated with the deadly fentanyl that we're seeing coming in from Mexico. So even if you're not necessarily somebody that prefers opiates, you might get something that's tainted with it. Even if something considered benign like cannabis from the street could be cross-contaminated with fentanyl.
Sonoran Prevention Works is a grassroots organization based throughout Arizona that helps reduce harm for people using substances who are not ready for recovery. Harm reduction is a philosophy and set of strategies that reduces infectious diseases like HIV and hepatitis C by providing clean needles and reducing overdose rates by supplying fentanyl strips and Narcan kits. Narcan, also known as naloxone, is a medication used to reverse the effects of an opioid overdose and is instrumental in saving lives.
We are seeing a lot of returns to chaotic use, which is also leading to a rise in overdose fatalities. We also have more people using by themselves because of the isolation, because of being cut off from society, and the drug supply is poisoned. It's just a recipe for disaster. And in a lot of rural communities, certainly tribal communities, it takes a while for EMS to get there. And once you stop breathing from an opioid overdose, you have 4 minutes until you die. So, people who use substances and anybody who is around them really needs to have access to naloxone or Narcan, which will work on opioids, including fentanyl.
The most effective treatments for opioid use disorder are medications such as methadone and buprenorphine, which are heavily regulated. But due to COVID-19, the federal government allowed a temporary easement on restrictions to allow for take-home doses to reduce in-person contact. That, coupled with the expansion of telehealth services, has had many positive outcomes.
The past year, we have learned a lot of new and different ways to do our work. We used to do our flagship training, which is called Overdose Prevention, Recognition, and Response. That used to always be an in-person situation. And now those trainings are offered multiple times per month, and they are done over Zoom online. We also started a program where we allow folks to request naloxone through our website, and we fulfill the majority of those requests by mail. This is really, really helpful in increasing our reach in rural areas. Those folks who take medication-assisted treatment, especially methadone, they're able to get a lot of their life back when we don't demand that they go to the clinic every single day to pick up their dose.
Rural communities like Mojave County in Arizona has seen significant numbers of overdose fatalities and higher cases of HIV and hepatitis C because of needle sharing and less access to services. But now Sonoran Prevention Works is seeing positive changes resulting from adaptations made during the pandemic.
One thing that's really cool that happened here is our local methadone clinic expanded their hours and saw a big increase and return of former clients. Kingman's kind of a late town, so staying open until the afternoon, and they didn't have to stress so much about making it to the clinic before it closed. I also see just a lot of really positive changes. I see people carrying naloxone. I see people teaching their friends how to use naloxone, talking with their friends about how to stay safe from fentanyl. I see people getting jobs, getting their physical and mental health taken care of.
Kodak Health Recovery and Wellness is one of Arizona's oldest providers of care for mental health, illness, addiction, and trauma, and have remained open 24/7 throughout the pandemic.
If you want to look at the biggest positives out of the last year, really was the implementation and the increased use of telemedicine and telephone services. It's really enabled us to keep better contact with our members by allowing us to really expand the methods that we can use to keep in touch with folks. We've increased the number of people we're able to contact and the frequency that we're able to keep in touch with our members. Altogether, we treat about 2,300 people at this clinic for different types of services. Now, what we did find over time is a lot of those people started asking to come back. They really benefit from the structure of being seen every day, really to help them make those changes in their lives and to stay clean.
With overdose fatalities being on a troubling upward trend in Arizona, educating the general public is more important than ever. Destigmatizing substance abuse and knowing what Narcan is, where to acquire it, and how to administer it means saving lives. Organizations like Sonoran Prevention Works and Kodak provide these materials and training.
You don't just take a Narcan kit and take it home and figure you know how to use it. Even as we give it out, we train people how to do it. Our staff have been trained by either ASU or Sonoran Prevention Works as well. They understand how Narcan works. You know how to administer, where to administer, when to administer, and we do that same training with anybody that we give that kit to.
We have easy access to Narcan kits. Our big VA or national VA provides those to us, but the university doesn't have an easy access to Narcan kits. So if somebody comes to the emergency room, for the longest time they weren't able to just provide a Narcan kit if you had an opioid overdose. You had to go to the pharmacy to get a kit, and that just those extra steps. So I think manpower and kind of just the actual kind of materials, both resources are needed. And I think once this is all over, the number of rehab beds that we will eventually need are far greater than what we have in our community or even, systemically.
We have to do a lot of work to convince the public, providers, family members that people who use drugs do want to take care of their health, dispel a lot of the myths around substance use disorder, as well as treatment and recovery. And I think that what the whole pandemic has shown is that when an issue is prioritized, we can act fast. Where there is public and political will, we can find solutions.
The median price of a home in Arizona has risen substantially over the last several years. In 2015, it was $211,000. Today, an astonishing $350,000. Many assume Californians moving in are the cause, but that's just part of it. It's a lack of homes. The supply of homes for sale in Arizona is at an all-time low. So, what if you went tiny instead, as in tiny house? Several years ago, Avi D'Amico did just that and set his sights on new horizons.
When I hear the phrase American Dream, it feels like shackles to me. My parents had a big house, went to college and got jobs, and when it was time for me, I went to college and I got a job and I bought a house, and I was just doing the stuff that I had seen. But I didn't like it. I wasn't happy. I had a 5-bedroom home in Minnesota. It was over 2,000 square feet. There was all this unused space, and it frustrated me, and I had to buy furniture to fill up the unused space so I didn't seem weird. Having been born there, I didn't really know that life could be any different. I'd been planning to move somewhere warm, but I didn't really know where, and I didn't really know when. I just stayed doing what I was doing until one day I got laid off. And I was like, why do I have to wait until I'm old to go somewhere warm? So I figured I would check out the Southwest. I definitely wanted to have fewer things and see how far I could take my downsizing. This house that I live in now is very small, tiny, most people would call it, and it's approximately 180 square feet if you just measure the width and the length. But if you count the king-size loft and the queen-size loft as usable square footage, it goes up to 257. But you can't stand up there, so a lot of people just consider this 180 square feet, which is less than 1/10 the space that I had in Minnesota. When the building company let me know that the house was about ready to be finished and delivered, I was like, well, I need to find a parking spot. Where am I going to put this thing? So I went to some RV parks, and they wanted to see a picture of what I was talking about. And they'd be like, well, that looks like a tiny house. And I'm like, yeah, it's a tiny house. And they're like, no, but this is an RV park. And I'm like, I know. And they're like, well, that's a tiny house. You should go to a mobile home park. So I started going to mobile home parks. I show them pictures, and they're like, well, that looks like a tiny house. And I'm like, yeah, it's a tiny house. And they're like, well, this is a mobile home park. And I'm like, yeah, I know. House, home, similarity. I can live in this thing. And they're like, well, it's too tiny. You should maybe go to an RV park. So I was just in this purgatory of, I want to put my house somewhere, but no one will take my money. It was a really freeing feeling to not have so much stuff, so many things weighing me down. Now I can do whatever I want because it's really cheap for me to live. My electric bills overall averaged about $20 a month. It's a little higher in the summer, but I don't think I've ever had an electric bill more than $40, and that's with the AC running a lot. As a cinematographer, I spend a lot of time getting paid to make other people's movies, but I have my own movie ideas too. And if I had a giant house and a giant mortgage, I would be really limited on what I could do. I wanted to make a movie, a full-length feature film, that was inspired by the actual hoops I had to jump through to set up a tiny home. But instead of it being another reality show or a documentary, I wanted it to be a romantic comedy. So I came up with these characters and these story that's very loosely inspired by real people I've met along the way.
All right,
okay.
Are you ready to do this?
Yeah.
How do you stay close to me?
1B, take one. Action!
We're going to be doing the majority of the movie over the summer, and then I hope to have it done by the end of the year.
I'll have you be like 2-shot, medium-ish.
When people hear that I live in a tiny house, they have usually one of two reactions.
And then that's when I see it.
They either are super excited, but there are also a lot of people who I'll meet and they're like, why? Like, how can you? Like, why would you do this? What's wrong with you? I feel so much happier and healthier, and in Tucson, you have mountain ranges in every direction. And I decided to climb all of them. When I'm on the top of a mountain and I'm looking down at the basin and I see the city and the other mountain ranges, I just have this sense of awe. And then when I come back to my tiny home, I don't feel claustrophobic because I just had this experience of being this tiny thing in this huge world. Really, losing my job was what gave me the kick that I needed to take the plunge and see how far I could take my downsizing. And I'm really glad that it happened, because changing my lifestyle and coming to Tucson has been the best thing for me.
Before we go, here's a sneak peek at a story we're working on.
We're going in. We're going in.
And we have
On the next episode of Arizona Illustrated, a behind-the-scenes look at the anxious and exhilarating moment when the OSIRIS-REx spacecraft captured a sample from the asteroid Bennu just as it begins its 2-year journey back to Earth. Thank you for joining us here on Arizona Illustrated. I'm Tom McNamara, and we'll see you next week.